Welcome to Module 8, the final module of regenerative orthopedics for arthritis, a SignalOme-based and voltage-guided approach. Today we synthesize your journey from conventional thinking to regenerative mastery. 8 modules ago you viewed osteoarthritis as mechanical wear and tear. Now you understand it as a reversible signaling disorder. This transformation in thinking transforms patient outcomes. You've gained powerful knowledge. The SignalOme paradigm, molecular staging, biologic therapies, voltage optimization, and precision delivery. Today, we integrate everything into your clinical practice. Section 1, the paradigm shift review. Let's review your transformation. You began seeing arthritis as inevitable degeneration. You now recognize it as SignalOme dysfunction, measurable, treatable, and often reversible. The SignalOme represents all molecular conversations within the joint. Destructive signal somes like interleukin-1 beta and nuclear factor kappa B drive degeneration. Regenerative signal somes like insulin-like growth factor 1 and the phosphoinositide 3-kinase protein kinase B, AKT pathway restore health. Your role is rebalancing this molecular symphony. The bioelectric dimension completes the picture. Proper transmembrane voltage, -70 to 90 millivolts, enables molecular signaling. Depolarized cells cannot respond to even the most powerful biologics. Voltage coherence determines regenerative success. True regeneration requires both molecular and bioelectric restoration. It's not enough to provide growth factors to depolarize cells. It's not enough to normalize voltage without molecular signals. Success demands both. Section 2, Molecular Staging Mastery Review. You've mastered molecular staging beyond traditional imaging. Stage 0, Balanced SignalOme, Healthy Voltage. Stage 1, Early Inflammation, Interleukin-1 beta elevation, Mild Depolarization. Stage 2, Active Catabolism, Protease Surge, Significant Depolarization. Stage 3, Fibrotic Remodeling, Transforming Growth Factor Beta, 3 Dominance, Severe Voltage Dysfunction. Stage 4, End-Stage Sclerosis, Complete SignalOme Collapse, Minimal Voltage. You can now interpret molecular signatures. Interleukin-1 beta indicates inflammation intensity. MMP13 reveals cartilage destruction. MicroRNA 140 shows regenerative capacity. COMP indicates turnover rate. Each marker guides treatment selection. Remember, molecular changes precede structural damage by 5 to 10 years. This window of opportunity allows true prevention and early reversal. You're not just treating shadows on X-rays, you're correcting molecular dysfunction. Section 3, Therapeutic Arsenal Integration. Your therapeutic arsenal is remarkable. PRP and PRF from patient blood. PDPA and PDPC providing complete SignalOmes. Wharton's Jelly MSCs for sustained regeneration. A2M for environmental reset. Hyaluronic acid for structural support. You understand when to deploy each tool. Early inflammation, PRP's gentle rebalancing, active catabolism, A2M's protease neutralization. Fibrotic disease, PDPC's anti-scarring signals. End stage, MSC's paracrine rescue. Your bioelectric tools restore cellular power. Frequency-specific microcurrent for targeted correction. PEMF for sustained normalization. Each frequency addresses specific dysfunction. 40 Hz for inflammation, 124 Hz for fibrosis, 8 to 15 Hz for regeneration. You've learned powerful combinations. A2M plus HA prepares the environment. PDPC plus MSCs provides immediate and sustained signals. PRP plus PMF enhances growth factor response. Combinations amplify individual effects. Section 4, the complete treatment algorithm. The complete algorithm guides every decision. Comprehensive evaluation, structural, molecular, bioelectric. Stage determination through integrated assessment. Protocol selection based on dominant pathology. Sequential implementation with proper timing. Monitoring and modification based on response. Long-term maintenance for sustained results. Your stage-specific mastery. Stage 1, PRP monotherapy with PMF. Stage 2, A2M, PDPA, PRP sequence. Stage 3, PDPC, MSCs, amniotic membrane. Stage 4, maximum intervention, repeated cycles. Each stage has its optimal approach. The advanced protocol addresses both dimensions, voltage assessment and normalization, biologic selection based on voltage status, simultaneous molecular and bioelectric therapy. This represents regenerative medicine's cutting edge. You personalize based on multiple factors. Age affects regenerative capacity. BMI impacts joint loading. Activity level determines functional goals. Comorbidities influence healing. Each patient receives tailored therapy. Section 5. Clinical Implementation Roadmap. Implementing this knowledge requires preparation. Equipment needs: ultrasound, centrifuge, PEMF devices, staff training for sterile technique and patient education, inventory management for biologics, quality control protocols. Start with fundamentals. Master one joint before expanding. Begin with stage 1 to 2 patients. Use simple protocols initially. Build complexity with experience. Document everything meticulously. Standardize for consistency. Create protocol templates by stage. Include dosing charts. Build consent forms. Develop patient education materials. Efficiency enables excellence. Your team amplifies your impact. Train nurses in biologic handling. Educate therapists on rehabilitation timing. Ensure coordinators understand staging. Everyone contributes to success. Educated patients achieve better outcomes. Explain the SignalOme concept simply. Set realistic timelines. Provide written protocols. Use visual aids. Knowledge enhances compliance. Section 6. Measuring and documenting outcomes. Systematic measurement proves efficacy. Baseline scores essential. Week 2, early response. Week 4, inflammatory resolution. Week 8, functional improvement. Week 12, comprehensive reassessment. 6 months, structural changes. Build your evidence base. Track every patient systematically. Include validated outcome scores. Document adverse events. Analyze by stage and protocol. Your data guides refinement. Contribute to the field. Case series for novel combinations. Comparative effectiveness studies, long-term follow-up data, biomarker correlation studies. Practice-based research advances the field. Share your successes. Case reports for exceptional outcomes. Poster presentations at conferences, peer-reviewed publications, teaching opportunities. Your experience benefits others. Section 7. Economic considerations and sustainability. Regenerative medicine requires investment but provides value. Compare to surgical cost and recovery time. Factor in quality of life improvements. Consider productivity preservation. Long-term savings often exceed initial costs. Navigate reimbursement strategically. Some procedures have CPT codes. Document medical necessity thoroughly. Offer cash pay options. Consider care packages. Transparency builds trust. Sustainability ensures longevity. Balance covered and cash services. Develop efficient workflows. Create treatment packages. Build referral networks. Success requires business acumen. Maintain highest ethical standards. Evidence-based treatment selection. Honest outcome expectations, appropriate patient selection, continuous education, ethics preserve profession integrity. Section 8. Future directions and continuing education. The field evolves rapidly. Gene therapy for targeted correction, nanotechnology for precise delivery, 3D bioprinting for tissue engineering, artificial intelligence for protocol selection. Stay current with advances. Future diagnostics will revolutionize treatment. Real-time SignalOme assessment, point-of-care microRNA analysis, wearable voltage monitors, AI-powered treatment algorithms. Precision medicine becomes reality. Learning never stops. American Arthritis Foundation conferences, peer-reviewed journals, online case discussions, hands-on workshops, mentorship programs. Continuous learning ensures excellence. Collaboration accelerates success. Join regenerative medicine societies. Participate in online forums, attend conferences regularly, share experiences with colleagues. Networks provide support and knowledge. Section 9. CME Requirements and Certification. This course provides substantial CME credit. Total hours, 8 contact hours. Category 1 CME through AAF, valid for state licensure requirements. AMA PRA Category 1 credits. You've addressed key competencies. Medical knowledge, SignalOme science and bioelectric mechanisms, patient care, evidence-based regenerative protocols, practice-based learning, outcome measurement and modification, systems-based practice, integrating advanced therapies safely. Complete these requirements for credit. Pass all module quizzes with 80% or higher. Complete final comprehensive assessment. Submit course evaluation. Provide practice implementation plan. Attest to completion. Your certificate demonstrates expertise. Regenerative orthopedics for arthritis, SignalOme-based and voltage-guided approach. Recognized by American Arthritis Foundation. Valid for CME reporting, display proudly in your practice. Section 10, Final Comprehensive Assessment Preparation. The final assessment tests comprehensive understanding, 25 questions covering all modules, case-based scenarios, protocol selection challenges, troubleshooting situations, 80% passing score required, review fundamental concepts, SignalOme definition and components, destructive versus regenerative signal sums, 5 stages of molecular progression, biomarker interpretation. These form the foundation. Master biologic properties, PRP versus PRF release kinetics, PDPA, PDPC composition and effects, MSC paracrine mechanisms, A2M protease trapping, HA molecular weight significance, understand bioelectric principles, normal membrane potential ranges, frequency-specific applications, PEMF parameters by stage, voltage biologic synergy, integration protocols, apply knowledge clinically, patient selection criteria, stage-specific protocols, injection techniques, complication management, non-responder evaluation. Section 11, Implementation Action Plan, your first month roadmap. Week 1, equipment setup and team training. Week 2, practice protocols with staff. Week 3, begin with simple stage 1 cases. Week 4, expand to combination therapies, document everything, 3-month milestones, master all injection approaches, complete 20 to 30 cases, establish monitoring protocols, refine patient selection, build referral relationships, confidence through experience, your 1-year transformation, full regenerative practice integration, all stages treated confidently, outcomes database established, teaching and mentoring others, recognized regenerative expert, define your purpose, restoring joint health through precision regenerative medicine, transforming arthritis from inevitable to treatable, advancing orthopedic care through molecular medicine. Your mission guides decisions. Section 12, Final Wisdom and Inspiration. You've joined an elite group, physicians who understand joints molecularly, practitioners who restore rather than replace, healers who address cause, not just symptoms. This is medicine's future. Remember why we do this. The runner who returns to marathons, the grandparent who plays with grandchildren, the worker who avoids disability. Each success validates your journey. You're not just practicing, you're pioneering. Every patient teaches something. Every outcome adds to knowledge. Every success inspires others. You're advancing regenerative orthopedics. Your impact multiplies. Each patient you heal influences family. Each success story spreads hope. Each avoided surgery preserves resources. Your expertise creates waves of positive change. You're ready for the comprehensive assessment. 25 questions synthesizing all modules, 60 minutes time limit. Review allowed before submission, 80% required for certification. Sample. Question 1, the SignalOme represents what? A, single cytokine pathway. B, only inflammatory signals. C, complete collection of all signaling networks in joint. D, mechanical stress only. Sample. Question 2. Stage 2 osteoarthritis with high MMP13 requires which initial intervention? A, immediate surgery. B, A2M for protease neutralization. C, corticosteroids. D, exercise only. Sample question 3. Optimal cellular membrane potential for regeneration is A, positive 20 millivolts. B, 0 millivolts. C, negative 20 to 40 millivolts. D, negative 70 to 90 millivolts. After completion, submit through the platform, results available immediately, certificate generates upon passing, retake available if needed, CME credits process automatically. Congratulations on completing regenerative orthopedics for arthritis. You've mastered the SignalOme paradigm, molecular staging, advanced biologics, and voltage integration. You're prepared to transform patient lives. Reflect on your transformation. 8 modules ago, arthritis meant inevitable decline. Now you see reversible signaling dysfunction. You possess knowledge few physicians worldwide understand. You're equipped to restore joint health. Remember these truths. Osteoarthritis is not wear and tear, it's SignalOme dysfunction. Molecular staging guides precision treatment. Voltage coherence enables regeneration. Strategic biologics restore balance. You can reverse the irreversible. Now, take action, implement these protocols, document your outcomes, share your successes, advance the field, transform lives. The world needs regenerative physicians who understand true healing. The American Arthritis Foundation supports your journey, annual conferences for continued learning, research grants for innovation, clinical guidelines updates, professional community. We're your partners in advancing arthritis care. Maintain connections. Join our online physician community, subscribe to quarterly updates, participate in research initiatives, share your experiences. Together, we're revolutionizing arthritis treatment. You now hold the keys to regeneration. Every inflamed joint can be calmed. Every degraded cartilage can be restored. Every patient deserves this opportunity. Go forth and heal. Access your certificate in the portal. CME credits report to SCCME within 48 hours. Download materials for reference. Begin your regenerative practice transformation today. Thank you for your dedication to advancing orthopedic care. Through the SignalOme paradigm and voltage-guided approach, you're not just treating joints, you're restoring lives. The American Arthritis Foundation is proud to welcome you to the forefront of regenerative orthopedics. Welcome to the future of arthritis treatment.